Home medical equipment, for instance, wheelchairs or oxygen concentrators like these, are a huge business in the United States, and they can get very expensive. But Colorado Public News did an investigation which shows there are options, and if some people pay more attention, they could pay a lot less.
This is the on-off button.
Without extra oxygen from her concentrator, Edna Fiore would die.
I would become very short of breath. I would eventually pass out and stop breathing.
This life-saving machine rents for more than $170 a month under Medicare, the government's medical insurance for seniors. With a 3-year contract, that means it will end up costing patients and Medicare more than $6,000, which is way more than it would cost on the open market, where you can buy one brand new for less than $700. You can buy a used machine for just $200.
And we've been saying this for years. We way overpay for this equipment compared to what it's available for in the private sector.
Medicare's Mike Fierberg admits overspending on home medical equipment is an ongoing problem. Just last January, Congress allowed Medicare to try a competitive bidding program. It was an attempt to rein in oxygen suppliers who many people feel were charging too much.
What's clear from this competitive bidding program is that they are willing to accept a lower profit margin than they have been making off the American taxpayer in the past.
The conflict is companies say renting a machine like this includes maintenance and service, whereas buying an oxygen concentrator saves lots of money. Once you've bought it, though, you're on your own. How big a problem is this? John Moore with American Medical Sales and Repair in Centennial shows customers how the machines work every day.
They're fairly basic as far as you have the on-off switch, you have the flow meter, and the main thing you're going to want to do is just make sure that it's getting out good pure oxygen.
Of course, not everyone wants to be responsible for calibrating and maintaining a machine that's critical to their health. Edna relies on a respiratory therapist to check her oxygen concentrator every 6 weeks.
So your filters need to be changed, see that right there?
Oh, yes.
Healthier patients can save themselves and the taxpayer even more money by buying the machine outright because it's still cheaper than years of copays. It's a choice many people don't even know they have. Carol McKinley, Colorado Public News.